Hi, I'm Mark Gussy. I'm the Professor of Oral Health at La Trobe University. I just wanted to briefly tell you about a project that I was involved in called Teeth Tales. Teeth Tales was a project that worked with migrant and refugee communities in inner Melbourne. These were communities of different cultural groups who came to Melbourne for various reasons. Some of them were migrants, some of them were refugees escaping pretty horrid conditions. Many of them had spent a lot of time in sort of camps as they awaited processing to come to Australia as refugees. The work started because health workers who were doing some work, not dental work, but doing some work with the communities, discovered that the communities weren't drinking tap water, weren't using fluoridated toothpaste, and were using high levels of sweetened soft drinks. There was also a lack of information or trust in dental health services. The drinking water was interesting because the communities told us that the drinking water in the camps that they'd come from had been unsafe, and so they actually preferred beverages that were bottled. And of course they were choosing sweetened soft drinks as an alternative to water. There are also some concerns about whether or not toothpaste contained animal products that was contrary to halal religious laws and sanctions. So there was a lot of stuff that we really didn't understand that was acting as barriers for these migrant communities. So we wanted to do something about that, and we wanted to create a trust and safety amongst the community when they interacted with dental care professionals. So one of the approaches we took, which is slightly different to many of the other approaches taken to oral health promotion, is that we used what we call community peer educators. So we actually went to the communities, we formed relationships with people who were important, so mothers, grandmothers, and also other key influential people in the community, and form relationships with those people. We then employed those people on an equal basis with our dental professionals, so that they were given legitimacy, and also we were recognising that the time that they spent working with us in health promotion was just as valuable as our time. So these peer reviewers worked with us. They developed an in-depth understanding of dental disease, how it worked and what could be prevented. And then it was their task to determine within their different communities or different cultural groups what the best approaches were to engaging mothers of young children in particular in oral health promotion activities that were acceptable and were sustainable, and also were going to lead to good health outcomes for their children. So the way they did that was not determined by us as the researchers. We gave them some generic skills, we empowered these peer educators, and then we said to them what would work in your community group. Mostly because we were very interested in young children, we worked in mothers groups, in community centres. We also involved grandmothers, because in some of these cultural groups the grandmothers were also very influential in childcare practices, which of course influenced oral health. The project was extremely successful. And we saw some very good oral health outcomes in terms of tooth cleanliness, in visiting dentists, and also the other thing we did was worked with our peer community reviewers to look at the dental services that were available in the communities. And so we conducted cultural competence audits of the dental facilities to ensure that when people from migrant and refugee communities approached the services themselves were configured in such a way that they were accommodating, they were accessible, and they were acceptable to migrant and refugee people. So we sort of worked from the service delivery aspect, but also very much from the community upwards as well, to make sure that those two activities meant that the services were more acceptable and communities were more willing to approach them. So a very successful project that involved looking at communities themselves and asking them what it is they thought would work for them.